if you are someone who has a diagnosis of cancer, whether it's breast, and maybe this recommendation might change actually. So if you have maybe breast or ovarian or pancreatic, should that patient be training? And I would love to maybe talk a little bit about myokines if we can, or
Sure.
if you feel comfortable talking about it. But should that person be engaging in resistance training, even if it's just as a goal to reduce the cachexia that we've been the muscle wasting that we've been talking about?
Yeah, and I'm of a pretty large group of people at this point that thinks that, if somebody is diagnosed with cancer, they should be not only given treatment from a molecular perspective, like a drug, but they should also be given assistance via registered nutrition for oncology. So there's specific registered cancers. They should also be given a cancer-specific PT. So what I mean by that is, again, the
personal trainer, physical
personal
therapist,
trainer,
personal trainer,
or potentially a physical therapist too. So the nutritional guidelines for a cancer patient are going to be different, especially depending on stage of cancer and those sorts of things for a cancer patient. So they need
and type, as we've been talking about.
Obviously type. So they need specific guidelines, obviously founded in evidence, to be able to make better choices about dietary habits as they progress through their disease and monitoring those changes. Alongside that, there will be things that come with treatment, whether it's surgeries or specific, even chemo can, unfortunately, it's not perfect. It's targeted, but it's not perfect because it's hard to delineate the, actual targets of treatments between normal cells and cancer cells because there is some overlap. But there's some level of off-target effects or toxicity associated with pretty much every treatment, whether it's radiation. So that will often impact a patient's mobility. So this is why I say that they should work with a PT, a physical therapist, or a personal trainer, or both, hopefully, to be able to do exercises that they can consistently and safely do throughout the treatment, because the range of motion that they might be able to do will be very different than somebody who's healthy will be able to do. So working with somebody who's professional in that space would be helpful alongside a registered dietitian who works regularly with cancer patients.
And can you speak a little bit around the mechanism of action in terms of what's happening when someone is resistance training? So we know every time that the muscle contracts, we're releasing myokines, and I was reading up on them for our conversation, and they're just fascinating, like effing fascinating. Can you speak a little bit about sort of the mechanistic targets and what's happening as a muscle is contracting, whether it's concentric, eccentric, and then how we are getting what are these myokines? What are they doing?
Sure. Now, this is a very diverse topic that we're learning more and more about over time, especially as technology develops and more labs are examining the usefulness of exercise in reducing disease outcomes, specifically in disease states. Now, in citing a specific study, there was a study done at Dana-Farber where, this is a mouse study. Again, very clear. It was a mouse study. They put these little mice on treadmills and they examined them. It was a tumor model. I think it was lung cancer. It's a form of lung cancer, I believe. I could be getting that wrong. But it was a cancer model. They put these mice on treadmills while they had cancer, and they examined the effects of essentially exercise in terms of what muscles were secreting specific myokines or cytokines that were associated with reduced tumorigenic processes or processes associated with tumor growth. And what they found was that obviously in the group that was just on treadmills, so this is just aerobic activity or aerobic exercise, they found that these mice had reduced tumorigenic processes, whether it's related to metastasis or even growth, compared to the control group that wasn't exercising. And they found that was specific. I might be killing the cytokine. It was more related to IL-13 or IL-15, one of those two. And so the specific myokine or cytokine was being secreted from muscle tissue and reducing processes associated with tumor growth, associated with the immune system. And so a lot of this stems from our physiological understanding between the coupling of our lymphatic system to muscle contractions and how it helps our immune system to work. So for a lot of people that don't know this, our lymphatic system, which is a series of networks and tubes throughout our body that is strongly right next to our muscle tissue, it doesn't have a pump. So the pump of our lymphatic system, which holds our immune cells in our body, is muscle. So this is why Gabrielle Lyon talks about the importance of muscle health and promoting longevity, and why we strive so much in terms of telling people to exercise is because in order to have a healthy functioning immune system, you have to exercise to promote lymphatic fluid movement. because the
Right.
muscles,
It's not like the cardiovascular system
right,
where you have
they
the
don't have a
heart
heart.
sort of driving the pressure gradient. Yeah.
Exactly.
Yeah.
So we need muscle contractions to drive lymphatic fluid movement, get immune cells throughout the body so they can respond to tissue damage, whether it's, cancer cell processes, if you have a disease like cancer or other diseases like obesity or something like that, or diabetes, a variety of other diseases. But yeah, there's a variety of different mechanisms that are associated with lymphatic fluid movement and muscle contractions that really drive home how important exercise is in reducing disease outcomes.
And when we say exercise, we are talking specifically about resistance training. Is there a role for cardiopulmonary or cardiorespiratory, like cardio?
Yeah, I mean, so the type of exercise definitely matters, but I would say from a holistic level, what people need to get from this is just exercises that they can do for a long term. So we can do any experiment at the end of the day that shows that resistance training is better than aerobic training. But the most important thing that anybody can do regarding their training is just something that they can consistently do for as much time as possible safely. So it doesn't matter which one is better than the other. It just matters the behavioral tendency to continue moving.
Yeah.
Does that make sense?
Great. Yeah, makes sense.